Good morning, Miss E. I'm Rachel Juniaris from Group 11, and I'm going to present the journal article in Post-Traumatic Stress Disorder. Introduction. This topic center concerns mental and emotional problems people experience in the wake of trauma, where the trauma is understood to refer to an event involving being a victim or witness to atrocity, violence through horror, and or the death of another or near death of oneself. The example on this is rape, murder, torture, accidents, terrorism, etc. So the DSM describes two trauma disorders: acute stress disorder and post-traumatic stress disorder. So we all know that the post-traumatic stress disorder could affect people who are suffering from past experience and a traumatic events. So it is also affects in your nervous system that reacts with your fight or flight response. Your heart pounds faster and your blood pressure rises and your muscle tighten, increasing your strength and reaction speed. PTSD happens when you experience too much stress in a situation. People, people who experience interpersonal trauma such as rape or child abuse are more likely to develop post-traumatic stress disorder. So, in developing in developing the symptoms of PTSD in the hours or days following a traumatic event, it can sometimes take weeks, months, or even years before they appear. And sometimes they are triggered by something that reminds you of the original traumatic event, such as an image, a noise, certain words, or a smell. So their treatment for PTSD can relieve symptoms by helping you deal with the trauma you've experienced. So, a doctor or therapist will encourage you to recall and process the emotion you felt during the original event in order to reduce the powerful hold the memory has on your life. The types of treatment available for post-traumatic stress disorder are include trauma-focused cognitive behavioral therapy and family therapy, medication and eye movement desensitization, and reprocessing EMDR. So the nature of post-traumatic stress disorder. In 1980, the American Psychiatric Association added PTSD to the third edition of its Diagnostic and Statistical Manual of Mental Disorders nosologic classification scheme. Although controversial when first introduced, the PTSD diagnosis filled an important gap in psychiatric theory and practice. So, the human condition has always included exposure to traumatic events. Survivors of attacks by saber-tooth tiger or the 21st century attackers are likely to have a similar psychological reactions. Shakespeare Henry IV appears to meet many, if not all, of the diagnostic criteria for post-traumatic stress disorder, as have other heroes and heroines throughout the world's literature. The history of developmental of the psychology concept is described by oh, from an historical perspective, the significant change ushered in by the PTSD concept was the stipulation that the etiological agent was outside individual rather than inherent individual mixes. The key to understand the scientific basis and clinical expression of PTSD is the concept of trauma. Next is the abstract. In article by Tanya Saraya, Teresa Lopez Castro in 2016, A Shame and Afraid, a scoping review of the role of shame in post-traumatic stress disorder. So this article demonstrates that despite substantial progress in the treatment of PTSD, P- PS, PSTD, certain people continue to be symptomatic despite receiving gold standard therapies. Improving treatment is one of the aspects of effective diversion that includes other emotions such as fear and dread. A systematic database review was carried out in order to locate literature on shame and PTSD. There were 47 studies that met the criteria, with preliminary evidence pointing to its effectiveness as medication. This review offers a conclusive synthesis of research to date, emphasizing the role of guilt in post-traumatic stress disorder care, and the present review serves as reference in the important field of research. Next is an article by Jennifer Huberty, Jenny Matthews, and Jen Leiferman, Joanne Kakiator, Catherine J. Gold on 2017, a study of protocol of a three-group randomized feasibility trial of an online yoga inversion for mothers after stillbirth. The Mindful Health Studies. So this study found that women who have a stillbirth have a fourfold increased risk of a positive screen for post-traumatic stress disorder and fourfold increased risk of depressive symptoms as compared to women who have a live birth. Yoga has been shown to be effective, acceptable, and safe for improving mental health in pregnant and postpartum women. They present a randomized controlled trial of two phases. The result of this study will inform a large-scale trial to see whether it home-based or online stream yoga can help people with post-traumatic stress disorder. Healthcare providers could use online yoga as a non-pharmaceutical low-price resource for stillbirth aftercare. The next is an article by Kali S. Barawi, Katrin Lewis, Natalie Simon, Jonathan I. Bison, 2020, a systematic review of factors associated with out of psychological treatments for post-traumatic stress disorder. The goal of psychological treatments for post-traumatic stress disorder are not always successful, and certain people can experience long-term symptoms. Factors linked to a positive or bad treatment result are largely unknown. Their goal is to close the gap. The produce they conduct is systematic review in accordance with the Cochrane collaboration guidelines. They look at variables that were linked to treatment outcomes, such as severity of PTSD symptoms after treatment and rehabilitation or remission. In 126 randomized controlled trials of psychological therapies for PTSD, the findings revealed that the association were either consistent nor solid. It's critical to figure out which people are most likely to benefit from such a treatments and to create more successful treatments in the future by identifying and organizing why certain variables are linked to treatment outcomes. In all clinical trials, there is an immediate need for consistent and standardized documents of factors correlated with patients' outcome. And next is an article by Cassandra M. and Safwan K. Al Khatib, Christopher W. Collins, and Alison J. Cole Adam, 2019. Autonomic and redox imbalance correl- correlates with T lymphocyte inflammation in a model of chronic social defeat stress. This article shows patients with post-traumatic stress disorder have a higher risk of developing comorbid inflammatory disorders. Although the mechanism causing the predisposition are unknown, T lymphocytes exposed to high level of neuroporine showed an pro-inflammatory signature resembling an autoreactive phenotype. According to previous research, the increase in sympathetic tone observed during psychological trauma can promote pro-inflammatory T lymphocytes, causing a predisposition to complete inflammatory conditions. The researchers hypothesized and using a mouse model of repetitive social defeat stress, they investigate that the effects of psychological damage on splenic T lymphocytes, cal- calprotectin levels in T lymphocytes, and in the bloodstream of psychologically stressed animals were elevated for the first time. So, calprotectin was linked to behavioral and psychological improvements following social defeat, implying that it may be used as a new biological marker and a therapeutic target for psychological distress and inflammatory comorbidities. Okay. Next is an article by Sean D. Fickling, Zach Frecklich, Trevor Green, etc. 2020. Brain vital signs detect cognitive improvements during combined physical therapy and neuromodulation in rehabilitation from severe traumatic brain injury and the case report. The researcher used a multimodal neuroimaging technique to monitor the recovery of motor activity after a brain injury. According to the paper, Trevor Green, a retired Canadian soldier captain, was slashed across the head with an axe. Continued regular intensive rehabilitation, including physical therapy and neuromodulation, in light of recent reports that motor function recovery can take longer than expected. So, ongoing cognitive changes with self reported improvements, they saw a sign of symptoms post traumatic stress disorder. Using the treatment of patient concentration memory from memory from previous traumatic events can check. The result provide insight into possible importance of non-invasive neuromodulation in cognitive recovery as well as suggestion of physical rehabilitation. Next is an article by Jin Zhang, Benjamin T. Dunkley 2020, classifying post-traumatic stress disorder using the magnetoencephalographic magnetoencephalographic connectome and machine learning. This study demonstrates that PTSD is an objectively observable biomarker that is extremely useful to clinicians and researchers. They use MEG-based machine learning-based classification framework for PTSD from trauma exposure controls and CVSVM RRFFS for defining the most relevant PTSD classification attribute. So, in the CVSVM analysis, they choose the smallest number of edge per frequency to serve as a PSTD signature. So, when people are distinguished from highly traumatized control group, the creation of a classification model for PTSD is used to provide a framework for classifying other mental health conditions using MEG. Next, in an article by Muhammad Ali Moni, Ping Lin Julian, M.W. Quinn, Balsama Ayapen, COVID-19 patient transcriptoma transcriptomic and genomic profiling reveals comorbidity interactions with psychiatric disorder. So this article shows some COVID-19 patients develop a psychiatric symptoms as a direct or indirect result of the virus. So but it is uncertain if SARS-CoV-2 infections correlates with underlying neuronal and psychiatric susceptibilities such as association may be the result of COVID-19 immune responses, inflammation of neurons, or social psychological factors. To better understand this, we look for main gene expression pathways that were altered in COVID-19 and were also impaired in bipolar disorder, post-traumatic stress disorder, and schizophrenia, as this could reveal pathways of interaction that could be treated. So we also look at symptomatic COVID-19 patients, genome-wide association study (GWAS) results, comparing GWAS and whole genome sequence data from patients with bipolar disorder, PTSD, and schizophrenia. And and in an article by Akita Naka, Jun Saiki, Shinjin Ichihayama, Philip H. Cass, 2019, Effects of Pets on Human Behavior and Stress in Disaster. So, in this analysis, the post-traumatic stress disorder result of pet owners and non-pet owners in Japan were concentrated, and their attitudes toward pets were evaluated in the aftermath of the earthquake disaster in 2011. They conducted an interview at an animal welfare event, finding that the pet owners had higher PTSD scores and non-pet owners 4.4 years after the tragedy, and advising them on the disaster preparedness. This study suggests that the pets can play an important positive and protective role for disaster victims. Next is an article by Harnit Sai, Adarsh Kumar Ambika Gupta, Anju Redhu, 2020 Impact of COVID-19 on Indian Dentists, a cross-sectional survey. So, so in COVID-19 and associated lockdown have had some detrimental effects on the healthcare professional, with the maximum of fear getting infected and further transmitting the infection. Dentists are suffering from the psychological meltdown along with the physical changes due to altered lifestyle. Aim and objectives of this study is to evaluate the psychological and physical effects of COVID-19 and consensual lockdown on dentists and understand the possible reasons for the problem they were facing amidst lockdown due to changes in their lifestyle. So, the Indian dentists have a total of 453 respondents completed the survey, and their materials and method clustering sample method was used, and the dentists were segregated into four groups. Next is an article by Steve, Susan Gardus, Nigel, and Andre Horsch, 2020, parental birth related post traumatic stress disorder symptoms and bonding in the early postpartum period, a prospective population based cohort study. Since both parents can experience PSTD after childbirth, this article illustrates how PSTD symptoms can affect mother infant connection and their interactions. PSTD of childbirth. Motherly PSTD-CB symptoms at 1 month postpartum were found to be negatively correlated with mother-infant bonding at 3 months using structural equation modeling. After correcting for psychological distress at 1 month postpartum, this effect vanished and no such effects were observed for fathers. Next is an article by Mehmet Hamid Bostas, Amit Tamer Aker, Karim Munir, Faiza Selik, and Adam Aydin, excuse me, 2019 Post-Traumatic Stress Disorder among Adults in the Aftermath of 2011 Van Erkis Earthquake. So, the aim of this study is to test for PTSD in a people aged 15 and up who live in Eric Van area for 9 months after the earthquake, as well as to look at the clinical and trauma-related aspects of PTSD diagnosis. They choose 1,498 participants on their area using stratified sampling frame. So, post-traumatic stress disorder was found to be 35.5% significant among Van earthquake survivors. According to their findings, being a woman and being unemployed are also risk factors. Having severe family problems as well as traumatic experience in the past, the PTSD, the, the PTSD was found to be prevalent in 35.5% of burn earthquake survivors in the sample. Any factors that occur before and after traumatic incident may play a role in development of PTSD. Next is in article by Mimosa Shahini Marita Shala 2016, Post-Traumatic Stress Disorder in Kosovo Veterans. The aim of this study was to look into the prevalence of PTSD in veterans 8 years after the war to see if there was a connection between PTSD and other demographic and health related variables, and to see if depression and trauma had an effect on PTSD in 687 veterans from 6 municipalities in Kosovo. 670 667 war veterans were chosen from 6 Kosovo regions in 2008. The Harvard Trauma Questionnaire and Hopkins Symptoms Checklist were used to assess PTSD and depression, anxiety, and respectively. So, self medication could be one way for veterans to cope with PTSD symptoms, according to the result. So, the study discovered that 8 years after the war, veterans of the Kosovo War suffer from PTSD symptoms, with a large of number of them refusing to seek treatment. The establishment of sufficient state facilities would turn these veterans dealing with PTSD into a constitutional right to fair and high quality services rather than a moral challenge. So next is an article by Taeyong Kim, Sejum Kim, Jong Rak Choi, Seng Choi Lee, Jin Kim in Sikwang 2017, The Effect of Trauma and PTSD on telomere length, an exploratory study in people exposed to combat trauma. So this study shows that the veterans who were subjected to fighting stress during the Vietnam War are more are more likely to develop PTSD and other cellular aging factors. They use a quantitative PCR based technique to assess leukocyte telomere length in Korean male veterans with or without PTSD. There was no noticeable difference in telomere length between those who had PTSD and those who didn't. According to the explanatory result, PTSD combined with extreme trauma may to be correlated with accelerated telomere shortening, and antidepressant may protect telomere dynamics. And using a PCR-based approach, they compared Korean males veterans with PTSD to those without, finding no major difference. So next is 14. An article by Abdullah Jawoba, Peter by James Nuhuba, Amara Bangali Sesai, Stephanie Sevali, 2019, Prevalence of Anxiety, Depression, and Post-Traumatic Stress Disorder among Ebola Survivors in Northern Sierra Leone, a cross-sectional study. So, the aim of this study was to see how common anxiety, depression, and post-traumatic stress disorder were among Ebola survivors for 2 years after they were discharged from the treatment center. They used the HAD scale to assess anxiety and depression, and the PTSD checklist to assess PTSD. Ebola survivors who exercised less after ETC discharge were more likely to exhibit signs of depression, PTSD, and anxiety than those who exercise the same amount after ETC discharge. So the finding shows that the PTSD, depression, and anxiety are common among Ebola survivors in Bombali district of northern Sierra Leone. emphasizing the importance of diagnosis and managing mental health issues among survivors after they have recovered from disease. The cognitive behavior therapy and intrapersonal therapy need to be toured as a part of overall mental health care package interventions. So, last but not the least, an article by Laura Orsolini, Stefania Chiappini, Umberto Volpi, Demonico De Berardis, Roberto Latini, 2019, use of use of medicinal cannabis and synthetic cannabinoids in post-traumatic stress disorder, a systematic review. So the aim of this study is to evaluate the clinical and therapeutic potential of using cannabis and synthetic cannabinoids to treat PTSD patients. The findings were divided into two categories, with the conclusion that it include have therapeutic potential for improving PTSD symptoms such as anxiety reduction, improvement of sleep, and memory modulation. Cannabis and synthetic cannabinoids can play a role in the treatment of PTSD. According to the current research, however, there is no proof. So, that's it. Thank you po, Ma'am Iya.